Welcome back to the channel. Today, I'm going to be introducing a new segment of the podcast, which is On the Couch with Adeola Ekine. I have a very interesting guest with me today. You've always been asking questions on menopause. I remember the first video I did on menopause, a lot of people commented and asked so many questions. And I promised you that I'm going to bring somebody that is a professional that will take us through all the questions, all the things we need to know about menopause, about premenopause, about menopause, and about postmenopause. Today, please, I would like you to welcome with me Mrs. Folake Oyetunji. She is the Deputy Director, Nursing Services, DDNS, and presently she is the matron of the Clinic of Lagos State Printing Corporation. You're welcome, ma'am.
Thank you very much.
Quickly, I want to go into the questions, but first I would like to ask, of course, I know you entered menopause so many years ago. Some of us are still dancing between menopause and jumping out of menopause. So I want to ask, what is your experience like when you started feeling the symptoms of premenopause, and at what stage did you enter full menopause?
Thank you very much. Menopause divided into three parts. We have premenopausal, menopause, and postmenopause period. During the premenopausal period, there is a withdrawal of hormonal substance from the body, from the bloodstream. The hormonal substance is estrogen and progesterone that supported fertility and body shape. But when there is a decrease in these two hormones, you start having premenopausal syndrome right from the age of 45 to 52. It can come earlier than that. We can see some cases that has come at the age of 40. Some will come with it at the age of 42.
Some even enter at 30, some cases.
Some cases. So in this period, you experience so many things. Because this hormone, estrogen and progesterone, support reproductive system, supports the production of ovary, supports the endometrium of a woman, support the breast structure and tenderness. The moment these hormones start to decrease in quantity, there is a lot of symptoms that you'll be facing as a woman psychologically. Menopause is not a disease, but it's just an event you have to pass through, and it's normal. The only thing is that when you are not educated or well informed, that it will come, so it becomes a surprise and disturbing. But when you are well informed, you have no problem with menopause. And during the premenopausal syndrome, the first thing you will experience is that the bleeding will be irregular. There might be spotting, then there is cessation of bleeding. The bleeding might not come in some months.
Yes.
Or 2 or 3. So it will not be regular as usual. This is the sign of premenopausal syndrome. Some even disease condition
have
that sign too. So when you see something like that, you have to contact your doctor, go through some tests to know that it's premenopausal syndrome or is something else. So that is then during the period of premenopausal syndrome, there are some symptoms that you will experience, like vaginal dryness. You will experience it. Then there are some hot flush when you will be having temperature, feeling hot suddenly, and in a matter of 2 minutes you feel cold again. You'll be sweating profusely. Sometimes it's very, very disturbing. Then during the premenopausal syndrome too, you can still experience this issue of sleeplessness, insomnia, and you can even experience some kind of a little bit of lower libido. So all these are the signs. Then we have menopausal syndrome per se. That menopausal syndrome, the difference between that premenopausal and menopause syndrome is that there is complete cessation of menstrual flow. It will not come for the period of 1 year or more. That is
to show that you have really entered
the menopause. And at that time, the condition, your health condition, if you are hypertensive, it will be worsening sometimes. If you are diabetic, it will really affect it. And then so many things will happen in your body. We can start from the hair, from your head. The hair can start to fall off.
Thinning out.
You can start from your breast become look fuller sometimes. Sometimes it will come down. Sometimes you will experience pain in your chest. Sometimes you'll be having cramps and leg cramps and everything. There is a little bit of fainting attack in some individual.
Yes.
Some individual will experience fainting and forgetfulness.
That one
is very, very common in menopausal stage. A lot of things. Dryness of the vagina and itching. You will think that you are having infection. Then during the coitus, there might be bruises. You will be completely put off concerning sexual excitement. Depends on individual. If you are the type that you are sexually active, you might not feel it much. But if you are the type that you don't even like it from the beginning, it will pose a very difficult situation for you to go in for that. You will not even feel like having it at all.
A lot of marriages have been affected because of that.
Yes. Then there is bloatness. You just wake up some morning and your tummy will be so big, your face will be heavy. Bloatness, you will think that is something else. But in all this, you can still visit your doctor to know whether it is not
something else.
You cannot just sit down and
believe that it's menopause.
Believe that it is menopause. You have to go ahead and check yourself up. That is why nurses we normally advise at that age of 52, 45 to 56, that your medical checkup should be regular, at least once in a year.
Okay.
And your BP checkup should be regular, at least once in a week. At least you have to check your BP because a lot of fluctuation will happen. Post-menopausal syndrome.
There's no rest at all for women. No.
That period is very stressful.
The post.
But you don't, yes.
At what age does a woman get to that post stage?
At the age of 56 down.
So there are still symptoms for that stage too?
Yes. The symptom is just, it will be worse in like itching, loss of air, forgetfulness, and then irritation.
Do you know at that stage now, some people might confuse menopausal post stage to aging.
Yes.
The symptoms might be similar at that stage.
Aging and menopausal syndrome is part of aging.
Oh, for women.
For women. It is one of the factors that come with aging. So you cannot separate them from.
Okay, you've taken this total summary of the post, the pre, and the menopausal stage. But as African women, African mothers, of course, we start from menstruation, menstruation hygiene, sex, and all of that. And in this part of the world, we realize that a lot of African mothers don't really like talking about things like this.
Yes.
I will tell you for nothing that whilst growing up, some of us were given some information about menstruation that at the end of the day negates what we were being taught in school. So a lot of people were misled into various other things. So in this kind of climb, even menopause, in my last video I said people should be taught about menopause from the stages of teenagers. So they are aware of what they are going to come into later in life. So why do you think that in Africa, women shy away from topics like this? Menopause, sex, menstruation, things that we should naturally openly talk about to our children. Like, the world has gone global. If we don't discuss it with them, they will learn it online. They will learn from peer. So it is important that we discuss. Why do you think in our generation we shy away from topics like this?
The reason is that our generation is coming from one generation. The generation of our parents, they don't even know how their vagina look like. Whenever they want to have sex, they off their lights. They don't do it in the broad daylight. Some culture, they even close their eye
because
when they have to. So they don't have knowledge of what we are talking about. It just happens to them. They just tell you, don't do this, do this, and they don't discuss it. So in our generation, it's still better. In our generation, we open our eye and see what we are doing, but we don't have much knowledge concerning
where we are coming from.
Because of where we are coming from. And then the teaching, even when you meet the professionals, when they want to teach them about this thing, they give them another name. They don't even pronounce it as it's supposed to be. They said if they touch your thing, they touch your toto, they will not even go direct.
The name is supposed to be called.
They don't even call it. So it's something that they think is something secret.
Exactly.
That should not be exposed too much
or openly
discuss with people, because they see it as something embarrassing and should be kept under the at the dark side of life. So they don't have any knowledge about it. And we are exposed to it a little bit.
Yes.
Maybe because of the internet, because of the video we watch, and
because of the children we are giving,
and foreign films that we watch, we are able to see this thing coming up, but we refuse to discuss.
Why is that?
Because it's not all of us we are exposed to this thing. You know, when you watch these sexual films, you find it difficult to discuss with the other person because your parents should not know
that you are even watching
it, or they should not know that you even know anything about it.
When they are kissing in movies, we will remove our face.
Yes, we dodge our parents as if we are not interested.
Yes, or sometimes our parents will just forward that part.
Exactly. You know, so our generation, we are not too exposed comparing to our children's generation. That is why it's like that. And then the professionals too, they don't help the matter. They will say it in a way that people will not feel embarrassed.
They will design it.
They will design it in another way, give it another name, and describe it in a way as if it is abstract. Then it even affects our generation much, because by the time you start doing this thing, it feels strange. And you see, majority of us, we don't even like sex. We don't even discuss it.
I know.
With ourselves.
And you know, if we really want to go into this, majority of our generation were abused.
Yes. As children. And we cannot even explain
We can't even discuss it.
You cannot even tell your parents that you don't even know the name of what they used to enter you.
Exactly. And you can't express it.
You cannot even express it. So when you are raped, you look at it as if something just happened to me. And then they will tell you what happened. Say, that man.
You can't even explain.
That man, what happened? You will not even say, you don't even want to mention that thing that entered you. You know, surprisingly, you cannot even know, you don't even know the structure of your vagina. Even when you piss, you don't even know where the piss is coming out from. When you start the menstruation, you don't even know where the blood is coming from. You just know that the blood is coming out. And, you know, it's terrible.
It is. And that is, of course, that is the reason why we are doing this, to further educate.
Of course, it's
our generation, the generation that is coming after us. And of course, to be able to, allow even children, parents, to discuss openly with their children concerning this kind of their private sex, relationships, menstruation, menstrual hygiene.
Yes,
and even
they are
menopause.
very important. Sexuality,
generally,
menopause, menstruation, sexual hygiene, they are very, very important.
And of course, they have to be able to present themselves.
Of course.
You know, during our time, they said, you cannot have sex. The fact is that even if they have to tell them how to protect themselves, it is very important. So that there are different diseases out there.
Of course.
They can get pregnant for women and a lot of other things. So it's better to let them know, beyond the fact that you don't want, no mother want their child to have sex. But of course, we have to open our eyes to the realities of today, to the openness of the internet, and let them know in case, please, Is it condom? Matron, what will you advise that? How do you advise our younger generation when it comes to sex?
Well, when it comes to sex, there is a lot of things attached to it. We should let them know. Apart from the enjoyment that is paramount, the danger is much more.
Yes.
We have so many diseases that is very disturbing. Starting from vaginal wax, vaginal lice, gonorrhea, syphilis, HIV, a lot. If I start mentioning them, you might not even know
that
exists. Like that lice.
I've never heard about that lice.
There's lice. During sexual intercourse, you can contact it from the other partner.
Wow.
So all these things is there. So we have to be cautious. Especially if you've not gotten married to.
Exactly.
And there are some diseases that they are not curable. Once you have it, it will reoccur and reoccur. You can, but it will reoccur. Like vaginal wax.
Yes.
That one will grow like finger.
In the vagina.
In the vagina. And the children will be wondering, what is this?
Oh my.
It will grow like flesh and pointed like finger.
Do they operate such? Do they cut it off?
That is one thing about it. Depends on how big it is. Sometimes you take antibiotics, it will go.
But it
might reoccur. And it can grow inward.
To affect other organs.
So all these things, we have to let them know. That it's like wanted to eat a fish with a lot of bones. You know, the problem is more than the enjoyment. Let them know. You can do it, but this is what you can get from there. And then, you know, so many things we cannot finish talking about.
We cannot.
Today.
We can't.
If you say the picture is terrible, and most of the time the male, they contact this, they just use their drug for a period of 3-4 days.
Stop it.
And then they are relieved, they will stop. Because they've stopped, the thing will come back later, be in a big form. I know all this infection causes obstruction of the sperm. Sometimes as they are growing up, there is a consequence. So I used to tell my girl children, if you want to do something like this, make up your mind that you want to do it, and the consequence,
you will bear it.
You have to bear it. You don't blame anybody.
It's your decision.
So it is your decision, and you are responsible for it, and you must face it, and you must speak out when the other part comes. Because it will surely come one day. So I used to tell them, weigh it before you do it.
Think about it very well.
Think about it.
Is it worth it?
That is it. So it's not that don't do this thing or you get pregnant. There is more than
pregnancy.
More than that in life. Like HIV, yes, there is drug for HIV, but the drugs are not tolerable. As you are swallowing it, your system will complain. So you cannot be the same again. And then these things they never put it at the front of anybody that this one's having HIV. And the worst part of it is that even we health workers, we find that a man is having HIV, we only plead for that man to go home and tell your wife. Even if we know the wife, we cannot tell the wife
because that's the profession.
Your wife,
your husband, out of secrecy.
You can't say
you can't accept the person. If the husband doesn't tell the wife, how will she know?
We can only plead.
Hey.
So you have to wait. You have to wait. It's a beauty part of nature, but at the same time, you dive it with carefulness.
And responsibility. You have to be responsible.
That's all. So concerning the menopause, we're supposed to know what we are expecting as we are growing older. It's because we don't know. So all these symptoms are frustrate so
Depressing.
many women and even family. Sexually, some women will just decide, I'm not doing. It's not because of any, it's because they have dry vagina, and then they have, once your vagina
So in
is
that kind of
dry,
situation, what advice will you give to the families of women undergoing such, especially to husbands that are facing this kind
the
of
husband too, they have
scenarios?
their own to face as they are aging. They too, they go through all this, but their own is that they have low libido. Most of the time, they are depressed, confused, then they forget things easily. They are frustrated sometimes because, and they have low performance.
But the men own is not as popular as our own menopause.
It is, but the problem is that they enjoy varieties. You don't know.
Exactly.
They leave you and meet younger ones, and they dodge under them as if they are active. As they reach the age of their own, around 58, 60, 70, they go through it.
Okay, their own is in later life. It's not as early as ours.
It's not as early as ours. Okay. But we can see the younger people now, they've entered it through by the age of 45. That's why you see them drinking alomo, ogbonge, this and that.
To aid the performance.
To aid the performance.
Well, that is not advisable.
It's not advisable for somebody that is have hypertension or diabetes, because the performance may lead to stroke. And that is the end of the road. Even if they drink alomo after stroke, it won't work.
Over.
Yes. But the woman's soul is very pronounced and it comes early.
Exactly.
That is the difference.
Please, I would like you to really thank my guests, Mrs. Folake Oyetunji, the Deputy Director, Nursing Services, DDNS, and the matron of Lagos State Printing Corporation Clinic. Leave a comment, ask your further questions. I'm sure anytime we call on her, she'll oblige us.
Yeah.
And don't forget to like, share, leave a comment, and most importantly, subscribe. Thank you very much. See you next time.